We have different techniques, different images that we can use in in our daily practice. The first one there on your left is the regular mammogram. It is widely used not only in the United States but in almost everywhere in the world. It's still the gold standard for screening, not necessarily for diagnosis, but for screening at least. So that's the most used image. Also, we have breast ultrasound. We use it when we're not sure if there's something in the mammogram or we want to clarify something, so we use it. And the third one, right there in your right corner, is the breast MRI. It is useful in certain conditions, not very commonly used for this, but it can be used, especially in women that have breast implants. We like to use the MRI because it can be a little bit difficult to do the regular mammogram, and it also has certain risks. Of course, if you have ever gotten a mammogram, you know how it is. I'm going to explain to you, but here's a little image of basically how everything is done. So there you see that the breast needs to be like squished, I don't know how to say it, a little bit. So if you have an implant there, it might cause certain problems. The ultrasound is very simple. Basically, you have uh, like a part that it's emitting sound waves. It's not painful. It's well, it can be a little bit uncomfortable, but not painful. And the MRI, it's well, that machine you go through has like magnets around it, so you cannot use metal. But though there are very simple tests, not very painful. Probably the mammogram is the one that causes more troubles and discomfort in women, but it's the one we use the most because it's the cheapest. It's actually very effective. Um, so that's how we do it. Then what happens if you find something abnormal in any of these images? What we do is that the diagnosis needs to be done by pathology. That means a doctor that's specialized in pathology needs to see some tissue in the microscope and actually determine if that tissue is cancer or not. So of course we need to do a biopsy. There are several ways of doing this biopsy. Usually it is guided by certain image. Of course, from the outside of the breast, it is impossible for us to know actually where the part where we think the cancer might be is. So we use either ultrasound or mammogram also to guide the needle to the exact place. It just takes a little part of the tissue and it goes to the pathologist. He'll be looking at that in the microscope, putting certain dyes on it, and then he'll tell us if that is benign or it's cancer. So it is a process that takes some time, but now since this is a problem that's affecting so many women, since the moment you have a mammogram done till it's diagnosed, probably it can be less than 2 weeks, something about 10 days.